Hi everyone, I'm Johanna Hillschafer, board certified behavior analyst who transitioned to the field of OBM and workplace behavior. Welcome back to my channel. I'm literally just trying to make it today, like my little sign says. My daughter actually made this for me. It's so cute. It's so fitting. I'm just trying to, I can't even speak. I've been trying to make it through this whole week. I've re-recorded this video a gazillion times. My husband's working from home in his office. He's super loud. My daughter keeps coming out, and now there is a fly flying around. Great. So we're just gonna roll with it, do the best we can. I'm gonna give up on making this video, but I'm determined because I have a very, very powerful message, I feel like. It's an important message. I don't know if it's powerful. It's important. And so the whole purpose of this channel, again, is just to be real and authentic and help people see what's going on with workplace behavior. And I just talk about my day-to-day experiences. This one's gonna be a little unconventional, and I'm just gonna go ahead and break the stigma. I'm going through perimenopause. I feel so silly saying it. It's embarrassing. And I don't know why we're embarrassed talking about it. I don't know why there's a stigma. I don't know if it's because we're taught that it's TMI, so we can't talk about it. I don't know if it's because we feel like we're not allowed to talk about it unless we're 50 years old or older, because we all think that that's when it really happens. Well, guess what? That's a lie. Maybe it happens at that age for some people, but no, for most of us, it starts way, way sooner. Anyway, yesterday I had a healthcare appointment that was absolutely horrible, and I was sitting there being dismissed and frustrated. Oh my gosh, I'm itching. That's a sign of perimenopause, actually, for some. I can't stop itching for some reason today. It's hot, I'm having a hot flash, I'm hangry. Anyway, my healthcare appointment was horrible, and I'm crying at my appointment. I'm feeling frustrated, and then my behavior analyst brain kicks in, and I start thinking, this is exactly why people avoid their health care and they don't follow up with their stuff. It is so aversive. Yeah, it's just hard to deal with. No one wants to do it. It just makes the whole experience awful. So I'm just going to tell you my story and show you how provider behavior in healthcare settings drives patients away, and why this is a huge workplace behavior problem that is costing everyone. So I've been dealing, oh my God, I can't speak. I don't know if that's another symptom or what, or I'm just hangry. But I've been dealing with perimenopause symptoms, and I needed to see a new provider since we moved back to California. And I've had testing done before, and I've had hormone replacement therapy in the past, but knowing my luck, my doctor had to take me off of it because it made my blood pressure go through the roof, and it made my autoimmune disease flare. So, Anyway. So before my appointment, I went ahead and I did this provider a favor, trying to make their lives a little bit easier, and I uploaded my whole complex medical history ahead of time so that this person can review it. And I just feel like personally, when you're seeing a new client, patient, whatever, whoever you're seeing, it is just best to review all of the information first so that you know what you're working with and you know what to expect. It just makes the whole process smoother for everyone. The first red flag, honestly, the receptionist was so dismissive. Oh my gosh, that fly is back. Okay. She was just so dismissive. She told me there was a long waiting list, like months. I ended up calling back and I said, hey, there's some issues with my results. Could you get me on quicker? She said, I'll check. She checks briefly, and then there was no availability. So I said, well, I really need to see someone and I'm having pain. What are my options? And she literally says, call back. Okay, well, I'm supposed to call you back every single day and see if there's a cancellation. Like, can you put me on a list or something? no, I didn't even get that. Well, anyway, finally I made a complaint, and I was lucky enough to see someone. So I see this nurse practitioner, and first let me just say, I love nurse practitioners. I feel like they usually do a better job at listening, and I have had nothing but great experiences with nurse practitioners. So I was super excited. This practitioner, this person being a nurse practitioner, had nothing to do with my experience, right? This person misread my ultrasound results. No, I'm not pregnant, just having some other issues going on in perimenopause. But they didn't even believe I had perimenopause, even though I had testing, and I uploaded all of that stuff. And I documented that I was on hormone replacement therapy before. So I actually had to pull out the test results that I had on my chart, read them to this person so that they could see, hey, I have a fibroid and a cyst, and I'm in a lot of pain. And this practitioner literally said that they're both too small to be causing any problems. Okay, so I start crying at this point, and they say literally all you can do is just take Motrin. And I explained that, first of all, I can't take Motrin because I'm on medication for my autoimmune disease that affects my liver. It's just a whole thing, and it's not worth it. If you take any other medications with this autoimmune medicine, you just have to be monitored closely because it can affect your liver, and my other doctor is doing that. But I explained that sometimes I can barely walk. And it's awful. I'm not being dramatic. Usually I just have to sit down and ice it for like 20 minutes, and that takes away the pain for a little bit. But it's really affecting my life. And yeah, that was their advice. And then I asked about the hormones. Once I convinced this person I was actually going through perimenopause, and they just said, well, I'm going to put you on an SSRI for the hot flashes. Here's the thing. If you need that medication, that's fine. Go for it. But I wasn't okay with this because you're treating a symptom. You're not helping me figure out what other hormone replacement therapy or what other treatment I qualify for. And I'm already on all these other medicines. And I just don't need one more just messing up the balance of my body. It was just a horrible, horrible experience. I feel like they just wanted to get in there, get the exam done, and then be on their way. So I literally went with I went looking for a solution and then received no solutions at all that would be helpful. Now, as a workplace behavior consultant, here's what I see what's happening. Obviously, I'm not officially assessing the specific practice or this practitioner, this provider. I'm just sharing my experience, but these are common patterns that happen everywhere. First, that receptionist behavior, no, excuse me. Her behavior was not okay, but that does scream understaffed and overworked. When you're drowning in calls and appointments, you get short with people, you're exhausted, you're over it. That's not an excuse, but it's a reason, and it's a predictable outcome for poor staffing. Also, most organizations hire staff that is less experienced so they can pay them less and cut costs. Oh my gosh, I'm itching. Oh my gosh. Sorry. They basically take whatever they can just to lower the cost. The provider rushing through appointments, not reading the patient histories, classic signs of an overloaded schedule. When you're seeing too many patients or clients in too little time and you're being pressured to bill but make it fast and get everything done. Chop, chop, chop. Patient care suffers. Let's be real. not listening to complex cases. That tells me that either lack of training for complicated situations, or there's pressure to keep appointments short and simple. I just feel like when your matrix, oh my God. Okay, I'm not starting this video over, hang in there. When your metrics are based on how many patients you see instead of quality of care, this is what happens. Here's what a workplace behavior consultant would do. Come in and assess and see, is this person overworked? Do they need more education? Have they seen this kind of complex case before? Do they have proper guidance and support? Are their systems set up for success or just throughput? Is this a matter of not hiring staff that is a good fit for the job? Who all is a part of the hiring process, and do they know what kind of employee they're looking for? Or are they really just looking for someone to bill and make money? I don't know. In this specific situation, I don't know, but these are all common issues. I feel like healthcare organizations are trying to cut costs by hiring less experienced workers. As I mentioned before, God, I've got brain fog too. My goodness. Okay. They're overworking their current staff and they're burning them out. And guess what? Ding, ding, ding. And that creates dismissive behavior towards their patients. Wah, wah, wah. I cannot speak today. We're almost done. So here's why this matters. And it's not just about my bad day. This kind of provider behavior is exactly why people avoid healthcare follow-up. When you're dismissed, when your pain isn't believed, when providers don't listen, you stop going. You put off that mammogram, you don't follow up on your symptoms, and you avoid getting the help until it's an emergency. And that doesn't just hurt patients, it hurts the entire healthcare system. Emergency visits, they are expensive, more expensive than preventative care, and untreated conditions get worse and more expensive. Patient satisfaction scores drop. Good providers, they're out of there. They're leaving, they're burnt out. It is a behavioral pattern that is expensive for everyone involved. This same pattern shows up in every industry though. It's not just the healthcare industry. Overworked customer service reps who are short with clients. Overwhelmed managers, they dismiss employee concerns. Sales teams, right? They're under so much pressure to make those numbers, make those sales, that they push people away. They're kind of dishonest when they're making a sale, and they don't focus on building relationships, which builds trust and promotes, that helps customers come back, I guess is what I'm trying to say. Oh my gosh. When organizations prioritize numbers over people, whether it's patient visit per hour, sales calls per day, you get behavior that drives customers away. And then everyone wonders why retention is so low and satisfaction scores are terrible. So the solution, don't blame individual workers, right? Their environment is kind of all out of whack. Though sometimes there's a few bad apples and you do have people that are difficult to work with, but that's a video for a whole nother day. But honestly, just look at the systems, look at the workload, the training, the support. That's exactly what workplace behavior analysts do. Now, I heard someone say the other day that consultants just come in and tell you what you're doing wrong and then they bill you for it. Peace, they're out. Well, with OBM and using principles of behavior, you can come up with a plan that everyone agrees on. You make checklists, you take data, you summarize that data. You are actually helping with implementing a plan that is sustainable. You are coaching and training these employees and leaders on the principles of behavior and strategies, and you're out of there. Well, you're not out of there, but you fade systematically. Now, I still don't have a solution for my perimenopause. I'm going to talk with one of my other providers on my team and see what my options are. Oh my gosh, I'm itching so bad. But this experience just got me thinking about something bigger. Yeah, so I was determined to make this video. Okay, I'm hot. It's time to open a window and cut this video. In my next video, I'm going to talk about how health conditions like perimenopause and really just any medical condition you have actually affect workplace behavior and performances, because there's a connection between our health and how we show up at work. Most people just don't even think about it or want to talk about it, and we absolutely should. So, oh my gosh, if you can relate to this or if you've had similar healthcare experiences, let me know in the comments. Have you ever avoided follow-up care because of how you were treated? Excuse me, gosh, oh my gosh, this video's a train wreck. What workplace behavior patterns have you noticed that drive people away? Yeah, so this was a real authentic video. Me just trying to make it through perimenopause. And we did it, we made it. Whew. Anyway, hit that subscribe button if you want more real talk about workplace behavior, and I will see you in the next video where we're gonna break some more stigmas.